Risk factors of jaundice. Since jaundice usually accompanies an underlying disease, here are some of the more common diseases. Viral hepatitis A, B, C, D, or E. Alcoholic hepatitis. Pancreatitis. Liver disease. Liver cancer. And malaria. Diagnosis of jaundice. Family history, physical exam, blood tests, which do a blood count and hepatitis exposure, liver functions test, urinalysis, and depending on the results from the tests above, more tests might be taken if there is a suspected underlying disease in the liver, gallbladder, and pancreas. These tests include ultrasound, CT scan, MRI, HIDA-scan, and liver biopsy. Treatment of jaundice. The treatment of the jaundice depends entirely on the diagnosis of the underlying disease. Once the underlying disease is diagnosed, the treatment is planned from there. Various treatments are: mild jaundice cases can be treated with just some careful waiting it out and close monitoring by your doctor. Medications used for hepatitis C can also help treat the condition. Alcoholic cessation for jaundice caused by alcohol. Jaundice caused by drugs and other harmful products require the patient to stop using the substance. Steroids, diuretics and lactulose, antibiotics and medication, blood transfusion, surgery, liver transplant, and consult your oncologist if cancer is one of the underlying diseases with jaundice. Prevention of jaundice. There are various ways that your risk of contracting jaundice can be prevented, such as the following: taking proper medications and getting vaccinations against hepatitis A and B. Avoid unprotected intercourse, drugs, and take precautions against blood products and needles. Avoid contaminated food and water. Take precautions against malaria when traveling. Regulate how much alcohol you have. And avoid smoking. Complications of jaundice. Here are a few of the complications of jaundice: bleeding, infection, cancer, liver and or kidney failure, and death. In the end, you can see that jaundice is sometimes a sign of an underlying disease. If you suspect that you have jaundice, report to your doctor immediately to be diagnosed and look at various treatments if diagnosis is confirmed. For babies, bring your child into the doctors immediately to prevent the jaundice from getting worse.